Child sexual abuse, or CSA, is often the elephant in the room. Everyone knows it's a serious issue, but it remains a difficult conversation to have. Research is one place to start. While female victimization may be more common, male victimization is a huge modern-day issue. Male victims don't disclose their CSA histories easily or willingly, so having a comfortable support network around them is vital. But to form this, we need to ask ourselves, are we ready to listen? For too long, males have felt discouraged to reveal their stories of child sexual violence. Perhaps we've been a part of the problem by not counteracting gender myths like boys can't be sexually assaulted, or stereotypes about how unmasculine it is to seek help. Fortunately, a Canadian Institutes of Health research team have stepped up to be a part of the solution by opening the conversation. Using a hashtag #CIHRTeamSV social media campaign, they have targeted stigma around sexual violence in males and have mobilized new knowledge. So far, several interesting findings have come from using large-scale datasets. At the point of reporting to child welfare agencies, caseworkers were less likely to note that male victims experienced emotional harm as compared to females. Male victims were also less likely to be placed in out-of-home care. This is a disconnect to the research that showed persistent post-traumatic stress symptoms for many male victims. Following up victims 5 years after the CSA report was substantiated, male victims were 2.2 times less likely to see a physician for physical health than female victims. However, males were 2.3 times more likely to see a physician for mental health problems. Compared to the general population, male victims also experienced a 10-fold increased risk of being hospitalized for health issues. But how does having this background affect other areas, such as dating in adolescence? A high school survey found that 21% of girls and 5% of boys reported experiencing CSA. And of those affected, 1/5 reported experiencing sexual coercion from their dating partners. This tells us that consent and sexual negotiation skills seem important targets to protect youth from re-victimization. So, where do we go from here? There are at least 4 pathways forward. 1. Taking sex and gender into account will keep us focused on the "what about the boys" issue. 2. Trauma and violence-informed healthcare is critical, especially in males. 3. Service providers must ensure safety in young people's environments and relationships. 4. Public health needs to tackle sexual violence as it has with other forms of violence. Without support, victims become even more isolated, leaving their health to suffer. We cannot let that happen. Fortunately, research is guiding us on how to prevent this. And, as a result, the elephant is finally out of the room.